Elizabeth Rojas, Cincinnati 2030 District Director, and it's an honor to welcome you all here today. As the pandemic continues to shape our lives, we made the very difficult decision to make this a virtual event. In the absence of being able to walk around, network, and ask questions, please utilize the chat as if we were all together. I'd also like to ask everyone to type in their name, and if you're with an organization, provide that under participants. It's like your virtual name tag. Please mute yourselves today during the session, but feel free to share your face. Over the next hour, you'll hear from some of the Occupant Health Guide creators who are 2030 District members and partners. You'll also hear from the International Well Building Institute, the Health Collaborative, and we'll close the session today with a panel discussion with building members Fifth Third Bank and GBBN Architects. And then we'll allow time for questions. We recognize that the commitment to reduce energy, water, and transportation, these goals are already challenging. In approaching the occupant health goals, we want to assure you that the first thing that we want to do is provide an opportunity to have a conversation with our building members about the importance and benefits to the organization in increasing occupant health. This doesn't only have an incredible effect on the talent retention and recruitment, but also has an opportunity to significantly change the health outcomes in your organization and our community. The creation of this guide and the structure of this pillar continues to inspire me because of its collaborative nature. I see members and partners, community organizations, all working together for a common goal to help our region prioritize health and wellness. We have over 20 organizations ranging from engineers to building members, from facility managers to architects and HR consultants working together to shape the guide. I want to take a moment to thank all of those that support our work. Next slide, please. A special thank you to our platinum sponsor, the International Brotherhood of Electrical Workers. Our bronze sponsors are Skanska, Siemens, and Mercantile Center. Our affiliate sponsors are Interface Carpet and BHDP Architects. And thank you to our event sponsor today, M&A Architects. Next slide. We want to thank the countless building members, professional partners, community partners, and volunteers and Green Umbrella staff that have dedicated time and energy to make the district a vibrant, innovative, and collaborative environment. I'd like to introduce some of the creators of the Occupant Health Guide. Andrew Odom is a lead AP and store planner with Kroger. Jessica Glorious D'Angelo is an architect and Well AP with M&A Architects. And Yasha Og is an architect, Well AP, and Well faculty with Immersion Design. Andrew, I'll hand it to you. Next slide.
Good afternoon, everyone. As Elizabeth said, I'm Andrew Odom. I'm with the Kroger Company, and I'm currently the Health Pillar lead, team lead. So a little bit about the Health Pillar. Early on, the 2030 district here in Cincinnati determined that human health and occupant health within buildings was a very key, important thing for humans, as we spend a lot of our time indoors in office spaces, and those spaces have not had a lot of attention in the health realm as how the built environment can impact health. So this pillar really was built from scratch by the team and developing to improve occupant health through the built environment and determining what factors were involved in that. Partnering and collaborating with the Health Collaborative and the International Well Building Institute gave the framework for how the health pillar could be administered in the district. And we are one of the only cities in the country that has added a health component to the 2030 district. So we're definitely unique and in the forefront of this space. As Elizabeth said, Yasha Ogg and Jessica D'Angelo, both well APs, were crucial in building the Occupant Health Guide, which is the document that we're releasing today. And they will in the next few slides show some of the key factors of the health pillar and how it affects occupant health, as well as what we're asking members to do. With that, I'll kick it over to Yasha.
Next slide, please. So as Andrew was saying, when we started down the road of establishing the 2030 district, we realized that the need for occupant or human impact was missing from the 2030 district model. And so we started with trying to understand how can we incorporate health or a human impact as part of the 2030 district model. And from those early on discussions, we came to the idea of creating this health pillar as an additional component. And once we realized that we wanted to pursue occupant health, we then started to do research into, well, how do we gain an understanding of regional health impacts that are localized, and then how can we furthermore improve upon that and come up with physical built strategies that impact health. And so from researching into how to find public health data, we came across the community health needs assessment from the Health Collaborative, and Lauren will speak further about the Health Collaborative later on in this presentation, but we looked at the community health needs assessment from both 2016 and 2019, and then started to analyze down into the data on what are the major health concerns of Cincinnati and its greater region. And what we found out was that the major impacts for this region is really chronic disease as well as mental health. And if you go to the next slide, it sort of shows our process on how we created this health guide. And so understanding the health needs of our region, we then could start cross-comparing those with some insurance claims data that we then also cross-compared simultaneously with the well building standard, which is a healthy building standard similar to LEED, except that it's focused around occupant health and human impacts. And so cross-comparing what the impacts are from built strategies, from the research, from the well building standard with the health needs localized, we were then able to come up with a total of 20-something building strategies that we then narrowed down through many conversations to what we believe are the most impactful that are applicable to the majority of our members currently. And so the next slide shows the 14 optimizations, as we are calling them, from the well standard that we've landed upon, and as well as the main health concerns from our region. And so Jessica will go through the various different healthy building concepts that we've established, as well as some of the benefits as to why these were important.
Thanks, Yasha. If you could go to the next slide, please. So there are 7 categories, as Yasha explained, that are in this Occupant Health Guide. They are air, water, light, nourishment, mind, materials, and movement. And each one of these is really important, and it comes from all that research that Yasha just explained. Air, good air quality increases productivity and reduces respiratory disease. However, in Cincinnati, we are faced with not so great air quality in general. Cincinnati actually ranks among the worst in the nation in particle pollution, according to the American Lung Association. And the Southwest Ohio Air Quality Agency reported the Cincinnati region exceeds national levels for ozone. And in the tri-state area, data indicates that lower respiratory diseases are among the fourth leading causes of death. This is stats before COVID. Indoor air quality is actually 2 to 5 times worse than outdoor air quality. So when you consider those statistics, it really kind of sheds a light on the importance of good indoor air quality, especially when it comes to productivity and occupant health, which is why we're here today. And so we have selected strategies in this category that deal with air filtration and ventilation, as well as various ways to test those. Water was chosen because it's obviously a very important part of our bodies. It does a lot of amazing things for us. And the U.S. Institute of Medicine actually recommends that women drink 11.5 cups of water in a day, and men drink 15.5 cups of water in a day. So it's probably no surprise to anyone that almost a third of Americans don't drink enough water. And a lot of that has to do with real or perceived quality and taste of the water. In Ohio and Cincinnati, most of our water comes from the Ohio River and the Great Miami Aquifer. Both have been determined by EPA to be susceptible to contamination. Therefore, Greater Cincinnati Water Works has a wonderful state-of-the-art process in which they use to treat that water. However, it's amazing water when it leaves the facility, but our old infrastructure and pipes makes it not so great by the time it gets to us. And so with that, and since poor water quality can lead to gastrointestinal illnesses and neurological disorders, to name a few, we are encouraging our members to increase their access to water within their spaces, as well as to test the quality of their water. Moving on to light. Light is the main driver in circadian systems, which support our alertness and our sleep cycles. And there's a lot of research that goes into how if your circadian rhythm is disrupted or desynchronized, that it can lead to obesity, diabetes, depression, and metabolic disorders. So we have chosen 2 optimizations in this category that deal with circadian light in our workspaces, as well as enhanced access to daylight. Moving on to nourishment. Nutrition is obviously a critical component to a healthy lifestyle. And increasingly our diets, especially as Americans, are increasingly more refined, highly processed, and high in sodium, sugar, and fat. Ohio ranks 36 of 50 states in chronic disease issues. And the CHNA, or the Community Health Needs Assessment that Yasha mentioned, shows it as one of the top 5 health concerns in the region. And poor nutrition contributes to non-communicable disease and is a modifiable risk factor for a lot of those chronic diseases that are such an issue in the area. So we have chosen an optimization that focuses on local food environment and bringing community-supported agriculture into our member spaces. Moving into mind, the built environment can mitigate adverse cognitive health outcomes by supporting mental health. And I think the pandemic, the one maybe good thing I could say is that it brought awareness and normalized mental health. But before pandemic, it was estimated that over 30% of adults would experience a mental health condition in their lifetime. And the CHNA, the Community Health Needs Assessment, found that mental health, specifically depression and anxiety, was the second highest concern in the region. So the built environment can drastically help mitigate the adverse mental health outcomes by supporting our cognitive and mental health. It can buffer stress and reduce the chance of burnout. So we are encouraging our members to provide respite spaces, as well as enhanced access to nature. Moving on to chemical materials. Chemicals in building materials can be harmful. They can cause headaches and respiratory issues. Most notorious of these are something called volatile organic compounds, which are VOCs. They're known carcinogenic things. It's what you smell when you open something brand new, you get new furniture, you get new carpet. And it's estimated that 95% of widely used chemicals used now do not contain information on the impact to human health. So we don't actually know what 95% of our chemicals are doing to us. So we are highly recommending that members closely evaluate their cleaning products and protocols and monitor the emissions within their spaces. And moving on to movement, which is our last category. Movement increases mental clarity and decreases sick days. And in fact, sitting for 6 to 8 hours a day increases your risk for mortality and cardiovascular disease. We are encouraging our members to incorporate more active and ergonomic workstations and spaces within their buildings. If you move on to the next slide, please. The health guide, as mentioned, currently has 14 strategies that members can work to achieve. And we have provided intense requirements and very specific requirements for each one of these, as well as this checklist, which you can use to determine which ones you've achieved, which ones are in progress, and where you're going in the future. And we just want to make it very clear that these strategies are highly dependent upon each building, each company, and each product or budget. There's a whole range of members in our community, and so we want to be flexible, and we're going to work with you, both the 2030 district and all professional partners, to help you get there. And so I'm going to pass it off to Elizabeth now.
Thank you, Jessica. That was a great summary of all of the optimizations and the reasons why they're all important. Next slide, please. I'd like to introduce Dr. Lauren Bartosik with the Health Collaborative. She's the Senior Manager of Population Health Strategies. The Health Collaborative leads the Regional Community Health Needs Assessment, which Yasha and Jessica mentioned earlier. That was utilized to establish the local impact for our areas of focus. Lauren, I'd like to turn it over to you.
Elizabeth. Hi, good afternoon, everyone. My name is Lauren Bartosik, and as Elizabeth said, I work on our population health team at the Health Collaborative. Next slide, please. The Health Collaborative is a nonprofit located in Cincinnati, Ohio, that is leading data-driven improvements with our hospital, all local hospitals and all systems operating as our members. We're powered by the Health Information Exchange, so we operate as the region's HIE and work off of a platform called HealthBridge, connecting all of our hospitals with the real-time clinical data that gives them the opportunity to do quality improvement practices within their systems to lead to assess the triple aim of healthcare, which is better care at lower costs and healthier people. Next slide, please. This is a little bit of a data-heavy, word-heavy slide, so I don't expect you to necessarily read it, but I'll talk in brief about each of the kind of 3 general pillars that we have. And so starting on the right is our actionable data. And so through our HIE functionality, we operate on a platform called HealthBridge, in which we provide a variety of services through our HealthBridge suite that is allowing all of our hospital and additional members, so there's some behavioral health providers there as well as some other partners, to access real-time data for patients and clients within the region. We operate on a master patient index of about 12 million people. And so this gives the opportunity for all of these coordinated systems to work together to maximize continuity of care from clinical to outpatient, clinical to community linkages, to really make sure that they can have quality improvement metrics and meet their quality improvement metrics that they've set for themselves. On the left side, we also are largely working on our convening across the region. And so we do a lot of different types of gatherings, from executive level leadership all the way to local health departments and community convenings, to try to ensure that there is always a shared vision and shared approach to health across the region. The second item you'll see there is about fostering a culture of responsibility. And so although we operate as a 501c3 from a business lens, we do work a lot with our hospitals, and over this past 18 months have been very heavily involved in the region's COVID response. This has been a really eye-opening experience to allow us to showcase the ability that we have around convening in data to drive very real-time solutions. Many of you, maybe the ones that are local, might have been able to see the real-time dashboards that were created to showcase hospitalizations, ICUs, cases and deaths, positivity rate across the last 18 months. A lot of that work was done in partnership with Cincinnati Children's alongside the platform of HealthBridge and with our partners at our hospitals and health departments. Next slide, please. I work primarily on our team that focuses on population health, and we call this Gen H, or the health generation, or Generation Health. And this is the regional health agenda. And so a lot of our work is systems level approaches to population health. This can have a variety of different definitions depending on which stakeholder you might talk to, but in general, we are working to align and coordinate regional health response across hospitals, health departments, and community-based organizations, or CBOs, specifically to focus on PSCs, policy systems and environmental changes, social determinants of health, and health-related social needs. This crosses an individual, community, and societal level approach to try to maximize efforts to address the health needs of our community. This type of coordination comes primarily through the work of our community health needs assessment and the role that I play. Next slide, please. So the community health needs assessment is in fact a requirement for all hospitals and health departments across the nation. Under the stipulations of the Affordable Care Act in 2010, all hospitals that operate as nonprofit hospitals are required to complete an assessment of their community every 3 years to keep their tax-exempt status. Similarly, all local health departments, which are governed by the Public Health Accrediting Board, or FAB, are also required to complete a community health assessment. In this region, which is quite dense and has about 40 hospitals and 28 health departments that participate in our local community health needs assessment. The Health Collaborative's footprint is 14 counties, but our community health needs assessment spans about 26 counties. All major hospital systems in the area participate, as well as the 28 health departments that represent the counties and a few of our smaller cities that operate their own local health departments. Because all these separate entities are required to complete these health assessments on their own, the systematic way that we're trying to approach this is to do one large regional collective and coordinated health assessment. It has been taking place since 2010, every 3 years, and actually the 2019 one labeled as 2019 is the published date, but in 2018 is when data collection was happening. And so we actually just finished up data collection for the 2021 cycle earlier this summer. Much like my colleagues have said, what the purpose of this document is to do is to create a digestible, data-driven, objective, public-facing report that allows any stakeholder that's reading it to understand what the top health needs are of this region, and look for complementary strategies to address that in a subsequent guide that will be called the Community Health Improvement Plan. We anticipate that over the course of the next 3 years, until the next data collection portion happens, that strategies much like the 2030 district will be utilized when folks are looking at what the top health needs are as a solution to address those health needs based on the sector that they represent. It's been really exciting to be involved in the CHNA and particularly to see it be used in this way. The purpose of this report, although required by hospitals and health departments, is solely to be a public-facing document that can be utilized by any and all stakeholder that represents health in any capacity in the region. So we anticipate the next report to be ready in November, so stay tuned for that. But specifically for the upcoming health district and for the occupant pillar, the footprint that Cincinnati 2030 holds is quite large and is encompassed by the full regional CHNA. And so at the Health Collaborative, again, our focus is to have coordinated efforts across all different sectors and systems, public health, healthcare, and community health partners. And so we will continue to use this report, hopefully in the way that 2030 has, as a standing document to push a regional health agenda facilitated by this organization at the Health Collaborative. I think that's the last slide. So thank you.
Thank you very much, Lauren. That's a great summary of an incredible body of work that really was so instrumental in helping us narrow our focus on these areas. Thank you very much for that summary. Next, I'd like to introduce Dr. Angela Loader with the Well Building Institute. She's Vice President of Research. And, you know, IWBI is not just a community partner with the Cincinnati 2030 district, but also has just been such a great collaborator for all of the work that we've done. You know, we've had a lot of conversations for, I think, now maybe 2 years going on that have, you know, led to where we are today. And their encouragement and, you know, just collaboration has been really instrumental in not just where we are today, but also where we can go in the future with this. So I'd like to hand it over to Angela Loader.
Thanks, Elizabeth. And Cincinnati 2030 District has been fantastic to work with. We are so excited to see the localization of some of this work. Next slide. So I'm going to be talking a little bit about the context and what we see from our perspective of sort of adding health data to environmental reporting. Like, why would you want to report on health right now? Why is this so important from what we're seeing from our ESG experience and our experience with sort of investors and the kind of data that we get globally and the kind of requests we get globally? And also in the context of COVID-19. Next slide. And next slide. So we are in kind of a new reality around buildings, health, and human factors. When I started in this work, you know, you talk about healthy buildings and people just look at you like you're crazy. Like, what are you talking about, a healthy building? And I think we've seen, you know, next slide, we've seen with COVID-19 that simply isn't really an issue anymore. And one of the clearest ways we've seen that happen is an increasing interest in the S in ESG landscape. So ESG is environmental, social, and governance reporting. It is really becoming the de facto way of reporting for organizations that are engaging in any kind of governance or environmental work. And as you'll see, because of COVID, there's a lot of interest in what does that S entail, and can health be part of that? Next slide. This is partly because we've seen devastating effects of climate change, whether that be wildfires globally. I am not in Denver right now, but it's currently back to terrible, terrible air quality because of fires on the West Coast and in Canada. Next slide. As well as, of course, the opposite end with flooding and power outages. All of this, you know, this is but really being emphasizing why climate change needs to be part of this. Next slide. And of course, you have COVID, right? So next slide. All of this means that people are really taking seriously people's concern about going back to the office. We know already that disengaged employees cost a huge amount per year, $3,400 a year for every $10,000 in salary, some have anticipated, huge, you know, $370 billion in lost productivity. And this is a huge question we're having right now. How do people feel safe getting back to the office? Next question. Next slide, sorry. We know the evidence to date is showing that health is material. What that means for investors is that if you track health outcomes and your investment in health in your organization, this impacts your bottom line. And this is a huge conversation that's happening at a pretty big scale. In other words, the investor scale. Data to date that we've seen has seen that if you have health-focused interventions, that it impacts your building and employee performance. So a 73% positive impact on building lease rate, 62% positive impact on building value, and a 79% positive impact on occupant satisfaction. Meaning that if organizations engage in their most important assets, which are people, they often experience lower turnover and burnout, as well as greater productivity engagements, which are really driving the bottom line. So, I was asked to say, well, why would an organization be interested in these health pillars? This is some of what we're seeing. This is some of the reasons why. Next slide. And it's always good to do a level set. Not everybody on the call is public health, but when we talk about what do we mean by health, health is not just genetics and healthcare. In fact, 2/3 of what is impacting your health status and your health outcomes includes your physical and social environment and your lifestyle and behaviors. This is actually great news because it means that they're modifiable, right? And so what it leads to is that there are things that we can modify, called modifiable risk factors, that influence those health outcomes. And that means that the place that we spend most of our time, which is buildings, actually has a lot of potential to influence our health outcomes. Next slide. And of course, many of you have seen versions of this. If you're still not convinced of why I should talk about health, 90%, of course, of the investment for the owners are salary and benefits. So huge potential return on investment. Next slide. So what we're seeing is that the triple bottom line, we know pretty well that we need to talk about planet. We know we need to talk, of course, to be sustainable and a profit, but really the people side, the social performance side, and we're arguing adding H into that, right? So H under S for health is really a key part of a successful organization that shows resilience. Next slide. The issue is, of course, that the way that we measure social has really needed standardized health metrics. There's a huge variety of the way this is measured, the way this is reported on. We've been told, by S&P 500, like we're good on environmental and governance metrics. We've got really good metrics for those. We're not so clear about social. So well as really being asked by a lot of these organizations, hey, you have features and you've got evidence-based features. Can you help us fill in, just so to speak, the S? And here you've got Laura Kraft, head of Heitman and Global Strategy and SG, saying that during the last economic downturn, environmental factors got their legs. Back when we focused on energy and sustainability, we knew that this could increase our net operating income. Fast forward to the current situation with COVID-19, and social factors are paramount. People want healthy and safe spaces to occupy. So COVID-19 is really just pushing a trend that was already happening, and we are really excited about the work that they're doing with the 2030 districts and the health pillars to be able to fill some of that in. Next slide. So why is the Occupant Health Guide so innovative? Next slide. So we know that well features are one way to be able to do this. So we have features, this is a sample of them. We have 10 features for those that aren't familiar with the standard. We have features that look at equity and conclusion. In fact, we're working on a health equity rating, indoor environmental quality, health and safety. We have a health safety rating that came out based on COVID-19, as well as performance in multiple different ways. Next slide. And it's all evidence-based, but it's not necessarily localized. We're a global company, it needs to be, and this is a trick, to be able to create features that are applicable globally. So what we did a couple of years ago is we created country briefs based on global health data. Next slide. This is an example of a Canada one, we have a US one, of course. And they really identify building level solutions, in other words, well features, that address top public health concerns in the countries based on national epidemiological indicators of health. From the most well-respected public data set in the world, the Global Burden of Disease Study from the Institute for Health Metrics and Evaluation. Next slide. What does that actually mean? They link top modifiable risk factors, MRFs, those of you public health will know what we're talking about, Lauren, I'm sure, in each country, and rank well features based on how much of the health burden they can address. So for example, features on nutrition will address the top risk factors of obesity. Next slide. So we were super excited when we came out with this. This was one way for projects to be able to say, I'm pursuing these features. This will address the top risk factors in my country. What we didn't have is top risk factors for localization. So we knew that what's true at a national level may not necessarily be true exactly at a local level. Next slide. So the health pillars, and this is my last slide here, are a really great way to show this is localized in these data. We actually are looking at the health pillars as a model that we'd love to see repeated. In fact, we've had calls globally to ask to talk to Elizabeth to say, how can we do something similar? And we've also been asked, like, well, how do we do this and how do we measure these kinds of things? One of the ways to start with, and I'm happy to answer questions during the Q&A, is choosing which pillars best fit your organization. You start there. The second is getting a snapshot of your employee health through a pulse survey or a full survey. A full survey would be, we have pre-approved survey providers. They can ask a full suite of questions, or we're actually piloting a shortened pulse survey that has been used in Portfolio and Core and Shell across the world in Australia. That really gives you a quick snapshot. What's the health status? Are they satisfied in some of your indoor environmental quality? That really allows you to get a quick snapshot across your organization without the investment of the full survey. The advantage of that is that you can track it annually and you can benchmark against full survey responses. So happy to answer questions on like, what does it actually look like to implement this? But this is just some ways we're seeing that portfolios are doing this already across the world. Thanks.
Thank you so much, Angela. That was a great summary. And so I'd like to move to our panel conversation now. And, the reason that we want to have this part of the conversation is to really start to understand some of the folks that have been involved in this space already have some insights and have been thinking about what they want to do with their organization. So first, I'd like to introduce Jeremy Faust, who is Fifth Third Bank's environmental sustainability leader. And so Jeremy, we've heard a little bit about the optimizations from Yasha and Jessica. And I wanted to understand and maybe just share what Fifth Third Bank is doing to approach these optimizations and goals.
Yeah, thank you, Elizabeth. We appreciate the chance to kind of be a part of today's launch and really to be part of the ongoing effort that is the Cincinnati 2030 district and this great work that you're doing, that the community is doing around healthy, high-performing building spaces. Like a lot of the folks that are on the call today, we've kind of watched as building health has grown in importance and focus throughout the design space. And I think with the onset of the pandemic in particular, we're feeling these issues more deeply than ever, whether that's responses and preparation for COVID protocols, or it's just the adjustment that we're all making around having employees that have spent a year outside of the office and trying to account for all these new needs and lifestyles that people are living. I think the way we're looking at this, by partnering with the International Well Building Institute, by collaborating with the Well Building Standard, I feel like the Cincinnati 2030 district has just given the region this great new tool to assist companies like ours in what to focus on. So whether you're a small business who's kind of just starting this health-oriented design journey, or you're a large company that's, well on your way, we now have the health guide to help guide us, pinpoint what are the critical improvements that we can be making, and really focus our attention on things that are going to be really important. And then by engaging the local health data on top of that, we know that the optimizations that have been selected are really tailored to the needs of the local community that we have, that we're designing and kind of operating our spaces to address. Much of our work to date has focused on areas where we've seen a lot of internal agreement and interest. So I think about the well-focused areas of lighting, material selection, movement, are really great examples of this. In each of these segments, we're creating standard specifications for our office design to really improve where we've been historically, trying to integrate these new design principles into each new space that we create or all the spaces that we operate. I think about natural lighting and just giving more employees access to natural light. If you walked into one of our old spaces that we designed 20 years ago, they've got the offices on the outside and there's not a lot of natural light in those spaces. It feels dark. It doesn't, it doesn't energize you. But the new spaces that we've created are really prioritizing light as a design principle. We understand the research. We understand how important these things are. So we're creating spaces that really, embrace these principles, and the employees are responding to it. They notice it, they appreciate it, and that makes our spaces better, and it makes the work that our employees are doing better. On the materials front, we're trying to be more mindful of what we're selecting to put in those spaces, whether we're talking about fabrics or carpet tiles. There's just so much information out there today. There's so many different options for high quality materials that prioritize health, that prioritize sustainability at the same time. And it's really just a matter of kind of networking with people in our network, and really the 2030 district members are already offering us feedback on kind of how to improve the choices that we're making with materials. So a lot of great improvements there. And then the third piece I'd point out is on the movement side. I think in many ways, activating employees, getting them moving around, we all recognize how important that is to our health. And I think, again, in particular, having spent a year plus at home, we're used to getting up and moving more. We're not used to working in the same place all day. So we're trying to create opportunities for our employees to get up and move around by designing different types of spaces that meet their needs. So they're not in a single spot all day. They spend a little time in a focus area. They spend time in a collaboration space to talk with other employees. Maybe they need to be in a more relaxed setting. And again, trying to design spaces that encourage people to move and not sit in one space all day. Notwithstanding all the work that we've done to date, we know we still have quite a journey ahead of us. We know these efforts will continue as the science improves and as we have more opportunities to kind of partner, collaborate, and learn from others. I'm very much looking forward to digging further into the health guide recommendations. We know IWBI has put a lot of intentionality behind what they've put in there. We know the 2030 district has based this on local needs in the community. So in many ways, we feel like the priority of what we should focus on has been crowdsourced amongst a lot of experts, internationally and locally. And this helps us decide where we're going to focus. So we know we're not necessarily going to get to every one of these recommendations, but recognize we can learn a lot from this process and integrate these into our principles of building, design, and operation as we go forward. The other pillars of 2030 are challenging too, right? The energy pillar is challenging, the transportation pillar is challenging, but we know those challenges are important to kind of motivate us and keep pushing us forward. So we're excited to be part of this. We're excited to continue sharing our stories and kind of learning from the network of folks that are part of the 2030 district network, and really just appreciate the work that's gone on to date and how this supports us as an organization and the work that we're trying to do. So thank you.
Thanks so much, Jeremy. I appreciate that. It's really interesting to hear how a really large organization is working towards these goals, which is a very unique situation for some of the other building members. So Tiffany Broyles Yost is Director of Sustainability and Resilience at GBBN, and that's an architecture firm. And so Tiffany, having heard from Jeremy kind of how their organization is working towards these goals, your organization is much smaller, your building is smaller, and I'm wondering how you guys are seeing these as opportunities and challenges. And so how are you approaching these goals?
Yeah, that's a good question. And thanks for having me. I think as a new member and professional partner of the 2030 district, GBBN's really excited about just joining this kind of larger community of businesses and professionals who are trying to address the kind of urgent climate crisis that we have, but also expect more from their buildings. As architects, that's really important to us. And so I think expecting more from your building, that it's not just going to serve this programmatic need, but also that we can use our buildings, as Dr. Loader noted, have a big impact from the environment and the social network that we have on our health, that we can use our buildings to actually positively impact our health, to have positive impacts within the community, and to have a good positive impact on the larger environment. So that's exciting to us. And I think we are really trying to look at the kind of architectural side of these strategies. And we're undergoing a renovation in our office in Cincinnati right before we sent everyone home. So we were just about to kind of start construction and move forward at that point. And so we really were starting to evaluate, again, we had a focus on health and wellness for our own organization, and so that we could really understand it from a client side as you're going through this process. What are the how do we make decisions? Which ones are all budget-based decisions, and which ones can you really tap into to have a positive impact on your colleagues? And so I think for us, we're really excited about this because it does give the guidance. It does focus directly on the needs of our staff regionally. And in our own renovation, we were excited to earn a Fitwel 2-star certification. And Fitwel is another building certification focused on health and wellness, and in some ways similar to the WELL certification. And so for us, we're trying to start with where are we already in terms of the optimizations, and which additional optimizations do we think really will enhance the experience of our staff and really add value to what we're doing. And so, you know, I've got my checklist from the guide already, and we're starting to go through. For us, we're really focused on the lighting and the indoor air quality and materials. And so those are kind of some of our primary focuses. And then we're trying to look at some more of the operational side as we move forward. So some of those take a bit longer and are just policy changes, but as an organization that's 150 people globally with about 80 in Cincinnati, we can be fairly nimble with policy changes and some minor changes to the design of our space. So I think we're excited about this. It's also a good reminder to kind of not just do the best practice, but continue to push ourselves to do more. And so I think it's really great, and we're looking forward to implementing additional strategies here and to be able to talk to both our clients and our colleagues in this area about the benefits of them and what we've seen work successfully.
Thank you so much. It's really wonderful to hear what our members think. And so I'd like to open it up for questions, and you know, let's see if there's any that have already been posed. If you would like to ask a question, please either put it in the chat, or you can unmute yourself if you want to ask directly. Carol asked, how long did it take us to develop the guidelines? That's a great question, Carol. Going back a couple years, we started to even discuss, you know, what did occupant health look like? And we didn't know exactly how we were going to do this. So we started, you know, asking ourselves, is it just indoor air quality? Is it someone wearing a Fitbit? So we started in that area, kind of examining everything, but then we kind of quickly realized that there was a lot of research already backing the well building strategies. And so we wanted to align with something that was already created. So in all, I think it was, you know, about 2 years. Great question. Yes, Michael, thank you for that question. So Michael Forrester with the City of Cincinnati is asking what 2030's role is in assisting with the members achieving these. And, you know, to help our building members, we want to, first of all, engage in a conversation. Each building, each member has a different culture or different constraints and opportunities. So the way that we foresee working with all of you is that we'll sit down, we'll talk about what makes sense for your organization. So what are the priorities for you, for your occupants? What are some goals that you already have in place? And then we'll look for the opportunities and where that might align with renovations that are coming up. So if, for instance, you're at a point where you want to renovate and get new materials in the space or do a new space plan, that's an opportunity to look at the location of where people are sitting. There's another opportunity there for changing the materials out or looking at the workstations and how they're functioning. So there's a lot of opportunities there, but our goal is to support the members, as well as connect them with the building professional partners that are all, you know, engaged with the 2030 district already. Some of these folks have so much experience in answering these questions and know exactly how to help support different members. So engaging in those conversations and, you know, helping support as you go through.
Elizabeth, can I add to what you said?
Yes.
Just quickly, you know, some of these things are physical changes in your space, but some of them are operational changes and require a kind of policy shift. And I think one of the things we were trying to figure out as architects, but in the client role is, you know, what can we share and can we provide templates for different policies with our clients in the end? And I can imagine that, you know, those kind of things would be something that some of the professional partners could share with the district, you know, for everyone's use at some point.
Great, thanks, Tiffany. We have another question, how the 2030 district will collect information and data. So the way we're doing that is just good old-fashioned conversations. We will, when you go to the guide and you read through the different sections, you'll see that there are requirements in the back, and it says exactly what you need to submit to the 2030 district. So we'll work with the building members to figure out what they're doing, and then they'll be able to submit the required information directly to us. And then that's really just fulfilling your, you know, checking the box there. So that gives our building members the you know, credit towards that that optimization. Does anybody else want to piggyback? Andrew, do you have anything to add to that?
No, I think that's a great summary. I think working with the district and then connecting with professional partners to help assist where it is. I think Jeremy and Tiffany gave great examples of how different size companies are looking at it. From the Kroger side, it's fairly similar. It's really about getting into the occupant health guide at the moment and developing a collaborative team within your organization. So from the Cincinnati or from the Kroger side, I'll be working with facility engineering, with corporate social responsibility, with several different departments, and potentially even with Kroger Health Department as we navigate our system. So it's a mixture of both getting in contact with the 2030 district advisory facilities, but also internally getting, you know, the information to the right people within your own organization, and seeing how each, you know, facility, department, or whatever it is, has a different take, and be able to navigate what optimizations are beneficial for your organization.
Yeah, great. Thank you, Andrew. Well, folks, we are at time here. And so I just want to say, you know, thank you all for joining us today. These design principles and optimizations are intended to be utilized as an opportunity for us to have a conversation and start working towards the goals. You know, look at it as integrated into any of your planning as you're making certain adjustments in your space already. We appreciate everyone joining us today to hear about the guide launch. This is a really exciting moment for a lot of the folks that have been engaged with helping build it. And we really look forward to continuing the conversation with all of you about how we work on these together. So next up is a deep dive session that'll be September 30th at 1 o'clock. And that's going to be based on the poll results from today. And also, if you want to continue the conversation this evening, there's an in-person green drinks with other Green Umbrella folks at Northern Row Brewery. And so you can head straight over there. They had a hike before this during this time, and so they'll all be convening pretty soon at the brewery. So I hope to see you all soon, and be well, everybody, and we'll talk soon. Thank you.